Perfect. All right. So welcome once more to today's expert talk meeting. We are going to be looking at the self-care tools for project participants. I'm not so sure if all the organizations are aware of the self-care tools available for project participants, depending with the projects that you carry out, whether you documented them or whether you used them. But we have Kalyet Afya, one of our partnering organizations, who already put into use their self-care tools for project participants, especially in their health programs. And today we have Sarah from Kalyet Afya Foundation in Kenya, and she will be taking us through the topic. And we are going to have her present for 30 minutes, and thereafter you're going to have questions for 15 minutes, after which you're going to end the Facebook Live, and then we'll get an in-house meeting where we're going to share our experiences and later conclude. So probably some of you might be asking, who is Sarah? She's the project officer at Kalyet Afya Foundation, and she's a graduate in community development from Egerton University here in Kenya. And she brings energy, enthusiasm, and dedication to her role. She has extensive experience in creating positive direction and driving projects towards their ultimate goals. And without further delay, I welcome you, Sarah, to take us further. Thank you.
So good afternoon. Welcome to today's expert talk. As you have been told, my name is Sarah, and we'll talk about self-care tools for project participants. So Mother, kindly, you can share for us the screen.
Yes, please, in a minute.
So we'll start with an outline of what you are going to check today. We'll start with a brief explanation about Kalyet Afya Foundation, definition of some terms, some areas of self-care, our approach towards self-care. We'll also share some of our tools that we use for the project participants, the challenges facing self-care, the benefits of self-care, testimonial, and later the question and answer session. Next. So about Kalyet Afya Foundation. Kalyet Afya Foundation is located in Tachangwan, that is Nakuru County, along the Nakuru-Eldoret Highway in Molo Sub-County. And we started our operation in the year 2019 as a health organization with the aim to empower marginalized rural communities, particularly the women and the girls, to realize their SRH needs, access family planning, and other healthcare services. In our journey, we have also incorporated other programs, and that is the environment conservation and economic empowerment programs. So we'll start with the definition of self-care. And when we talk about self-care, it is the ability to care for one's health through awareness, self-reliance, self-control in order to achieve, maintain, or promote optimal health and well-being. So when we talk about self-care, we are simply talking about taking care of oneself. And when we go to the definition, according to the World Health Organization, it refers to the ability of individuals, families, or communities to promote their health, prevent disease, maintain health, and cope with illness and disability with or without the support of a health worker. And when we talk about with or without the help of a self worker, it is because some self-care interventions can be people-centered, while others are system-centered. So depending on the self-care tool that you are using or the self-care intervention that you are using, it may involve the help of a physician or the health worker or not. And when community members understand self-care, the importance of self-care, the available tools in the community, they are able to adapt self-care behaviors. And therefore, self-care behaviors refers to that conscious decision or conscious action that you take in order to improve your physical, your mental, your health, or social well-being. So in simple terms, I can say that self-care is the attitude that says I'm responsible for my own health. I'm responsible for my financial well-being. I'm responsible for my mental health. I'm responsible for my emotional well-being. So simply we are saying just shifting the responsibility of your health or your well-being to yourself. You yourself taking the action. So let's, next, Martha. So after defining the term self-care and when we are saying that after understanding the term self-care and knowing it simply means you yourself taking the responsibility for your well-being, let's now go further and define the term self-care intervention. And self-care interventions are tools that support self-care. And self-care interventions gives people the tools that they need to prevent diseases, maintain health, and manage health conditions with or without the health worker. And when some of the examples of self-care intervention, you have the drugs, you have the devices, and the digital platforms. And when you talk about self-care in health, we are not trying to replace the health systems. So what we are simply trying to do is add to the choices and add to the options of receiving these services. So when I talk about self-care interventions in terms of health, I'm not trying to separate individuals and the facilities. No, we are just trying to bring alternative, more choices to community members. And also remember that self-care is not zero cost. Just because you are doing it yourself, it does not mean zero cost. There are costs associated with self-care interventions. For example, if you want to, you may wish to visit.
Sorry, Sarah, we can't hear you clearly, and Lillian seems to be getting into the video. I'm not sure why.
Sorry?
We couldn't hear you for a minute, and I keep seeing Lillian popping in the video. Could you please all mute yourselves? Okay, Sarah, you can proceed.
So I was saying that when you talk about self-care, self-care does not mean zero cost. There are costs associated with self-care. For example, if you wish to go and get a contraceptive pill, there are costs associated in traveling or maybe small charges in the facilities. It's just helped to reduce the cost, but it does not necessarily mean zero cost. So next, Martha. Let's now check the 5 main areas of self-care. And maybe this is where the organizations that are in can try where they fit in. So we have the first the first area as physical self-care. And this simply means taking care of your physical body. So in physical self-care, am I taking charge of my health? Am I attending appointments? Am I taking the prescribed medicines? Am I utilizing family planning options? Am I protecting myself from STIs, from HIV or pregnancies? Am I eating healthy foods? And this is where, when we talk about deciding to eat healthy foods, you can decide on organic farming. Are you taking food safety measures and hygiene? So physical self-care, we are just talking about your physical body, check your health, are you exercising? All those interventions and many more can fit in that category. We also have social self-care, and this is the ability to build and maintain healthy interpersonal relationship with others. When you talk about social self-care, we are not talking about being a loner. No, we are talking about, are you able to maintain healthy interpersonal relationship? And in organizations, some of the activities that we can do to promote social self-care can be team building activities. We can talk about that, taking that short time with others to take lunch. We can also talk about joining community groups. So all these help you to build your relationship with other people, and therefore you take care of your social well-being. When you talk about the financial self-care, it is the individual action you take in pursuit of your financial well-being. So in financial self-care, are you budgeting? We can talk about, are you saving? And when we talk about saving, community members can be involved in table banking activities. They can be involved in self-help groups. Are the community members planning for retirement? All these interventions come in financial self-care. That action take in pursuit of your financial wellness. The next area is the mental self-care, and it involves your psychological and cognitive thinking and your mind's ability to understand and process information and experience. So in simple terms, when you talk about mental self-care, we talk about stimulating your mind with mental activities. And some of the interventions that can come in here, you can talk about any strategy that an organization can develop with the help of community members to cope with the mental health problems. We can talk about learning something new. You can say to learn a new language. You can play some mind games, e.g. puzzles. All these help to take care of your mental wellness. And lastly, we have spiritual self-care. This aims to nourish your soul. And when you talk about spiritual self-care, it does not necessarily mean the religious part, although to some it does. And some of the activities here we have, you can meditate, you can take nature walks, you can visit the places of worship, pray, any activity that nourishes your soul. Next, Martha. So having done that, I would like us to share a bit. So which category of self-care does your organization fall under? Just mentioning which category you feel you fall under, then in the discuss later we can share more about it. So which category of self-care does your organization fall under?
You can just unmute yourself and contribute. I'll go back to the previous screen for those who cannot remember. Hilary, Jane, Pascalia, Inasol, Solomon.
Hello, good afternoon.
Afternoon to you, Hilary.
Did she ask a question where does meditation fall?
The question reads, which category of self-care does your organization fall under? And she started by explaining the different categories or areas of self-care. So you need to place Restorative Seed Society in one of the areas or extras you've not mentioned.
So in fact, I cannot see the screen. I can hear very well, but it's been screen sharing all the while I've joined. So I cannot see. I can only hear everyone else, but I can't see the screen. So I don't really know what to say. If it's time for other comments, maybe I can make some
maybe
other
Martha, I can say something.
Yes.
Hello.
Hi, Jane. We can hear you.
Hello.
Hi, Jane. Kindly talk to us. We can hear you. Jane, are you there? Someone else before Jane comes back.
Okay, so the spiritual self-care, you see, we in Africa are more religious, you realize it. So sometimes the spiritual, I remember there was something World Vision take us through spiritual understanding the spiritual landscape, right? When you want to look at the project implementation, and sometimes you go and say, this place, we don't feed we believe in spirituality, right? Like, for instance, in our culture, there are some places they don't go to farm on Wednesdays and Fridays. So even if you are hungry and you have a farm and it's Wednesday, you don't go there. If there's water, you don't cross certain waters on certain days. You see it. So spirituality also affects some of the people. For instance, there is a river in my community, near my community, and there's full of fishes there. But religiously, they say they don't eat that fish in that water. If you eat it, you will die. And you go and see a lot of fishes, big ones in the river, and nobody is taking them. Meanwhile, it could have saved the children and give them protein. You see, so spirituality, as she said, is also one of the issues that under the spiritual self-care. Somebody was asking for certain examples, and I'm just giving some examples of what we do. So you may be aware of your community, what they believe, and what they practice spiritually, so that if you go there, you can overcome some of these things. Even that's why World Vision, they believe in spirituality. So even when they want to draw water in certain places, they make sure they send people to go and pray, because certain times they say that some people will go and drink water and they won't find the water. But when they go there, the same people will go and they find water. So spiritual aspects also impact the lives of the people that we have. And then the financial self-care, I think I want to ask a question about that. The financial self-care, you are looking at how the family will budget themselves, and they will be able to control their resources to make impact and the well-being of the people around. In our culture here, we don't have a lot of financial liberty to plan. So how do we go about the self-care under this area? We don't have regular resources that we say, at the end of the month, I'm going to get, let's say, 100 Ghana cedis. So I'm going to plan that 100 Ghana I'm going to spend in this particular order. So in our context, how do you plan about our financial self-care?
Wow, thank you, Solomon, for your input and your question. I've written it somewhere so that we reserve it for the Q&A session. So please kindly wait until we get to that.
Okay.
Jen, I see you're back.
Yeah, I got disconnected. My Wi-Fi disappeared.
Sorry.
So for maybe for me or for COSTEP, I'm very keen at physical self-care, whereby even at our workplace, we encourage healthy eating through organic farming, and and also about social self-care, whereby as COSDEP, we don't work in isolation, because we always strive and aspire to build and have relationships with other organizations. And so that one is also very important, having a healthy relationship with other organizations that complement our work. And also financial self-care, I think it's very important for everybody at a personal level and also at the organizational level, because we have to make sure that in whatever that we do, we have to be sustainable financially. So, and I think it all applies even for mental health care. It's very out there nowadays. Everybody is going through a lot. So I really want to know more as we go on, and how that this one, or all this comes, or how they do all this as an organization, or how they work with communities to ensure that all this work together, because I think everything is important there.
All right, thank you. I hope by the end of the presentation, you'll have an idea of how maybe to develop one along the areas that you fall as COSDEP. So any last contribution before you move to the presentation?
Okay, thank you. As for us, we are also doing financial self-care. We are working with youth and children, and we are providing them with the financial literacy. But because we are working with youth and they are growing up, and we're working to make them to be responsible adults. So within the financial self-care, the curriculum we are using is a social and financial education. So that is where also they are mentored to have the financial self-care, as they are mentored to know to budget, they are mentored to saving, they are mentored to have the wise expenditure of their money, and also engaging in other financial activities that can help them have income. But also they are mentored to social self-care, to the fact that they ensure that they have the health relationship, as we all know that youth are facing challenges, especially in the peer pressure. So we are mentoring them to ensure that they are aware of the health and unhealth relationship, and how they can maintain the health relationship and escape the unhealth relationship. So as Jane said, I can see all parts it's like they are interfering. Like when you're talking of the social self-care, the financial self-care, it's also you also touch the physical self-care, you also touch the mental self-care, because when a person is not mental health, it is very hard for you to train or to mentor or to coach him or her on financial or social or physical issues. So it's they are kind of interfering, but I hoped to learn more, especially on the mental self-care. Thank you.
Thanks, Kalyet. And please allow us to proceed with the presentation, and we can keep the conversation going when we get to the exchange part. Sarah, over to you.
Okay, thank you. So after learning about the 5 areas of self-care, I would love now to go to the next slide and share CAF's approach towards self-care. And in Kalyet Afya Foundation, we are currently dealing with the physical self-care. As I had said earlier, it's a health organization. So our approach towards physical healthcare is enabling communities to use self-care to stay healthy and take charge of their own lives. And this is significantly facilitated by 1, health literacy, and 2, access to tools, commodities, and products. So that is our approach towards self-care. It is health self-care, the physical self-care area. So the first thing we do, we ensure the community has information, is literate about the self-care approaches that are available, the importance of self-care and all that. And then the next thing, we access the tools, we avail the tools, the commodities, and the products. So next. So that is our approach. When I talk about health literacy, it is the foundation of our program, because you can't go and just start availing some self-care tools without educating the community on the importance of this self-care, why they should utilize them, why it is necessary to them. So the first thing you have to do, the community has to understand first the importance of these self-care tools that are available and where they can access them. So in Kalyet Afya Foundation, that is our first step, ensuring the community is informed. Next, Martha. And after availing the community, or creating awareness in the community on the different self-care tools that are available, we go further and provide those tools, commodities, and products. And we have different ways in which we provide these commodities or products or self-care tools. And we have mobile clinics, we have our CHVs whom we have trained, we have peer educators, and therefore our program runs from the schools to the communities to ensure they are able to get these tools. And when you are determining where to access these tools, you have to ensure that the environment is enabling, because you can have very good strategies, very good ideas, very good tools, you have all those things, but where you decide to provide the services or the tools discourages the community members. So that's why we are saying that a safe and supportive environment is essential to facilitate access to and uptake of the products and interventions, so that can improve the health and well-being of marginalized and underserved population. So in Kalyet Afya Foundation, our approach to physical healthcare is 1, the education, then we avail the tools. So next, Martha. So when you talk about physical healthcare, as community members are members of organizations, of course, we are involved in health in one way or the other, even though our organizations may not be dealing with health exactly. And there are some of these tools that we utilize ourselves. So that's why this question comes in. What self-care tools can I use to protect myself from pregnancy, from HIV and STIs, test for pregnancy, space children, and ensure I have timely access to quality information? And remember, when we talked about this, I said that some self-care interventions can be used by a community member individually and others are linked. And here I'll give an example. For example, we have a contraceptive pill. So that is a self-care tool. When I give a woman a contraceptive pill, after simple instructions on how to use them, the woman can use the pill comfortably at home. But there is a self-care tool, for example, the self-test for HIV and AIDS. In case the community member uses that tool and the result turns positive, it means that she or he needs a confirmation from the health facility to further diagnose the test again. And also we have self-sampling for HPV, human papilloma virus. So yes, a community member can give the sample at home, but the woman needs to take the sample back to the facility for it to be tested. That's why I said earlier that some individuals can be in control of some self-care interventions, but others require health facilities or health settings. So next, Martha.
Right. I was wondering whether that was a question for everyone. And then I was smiled thinking like, we have an enabled environment to answer it. Anyway, just available.
So I'll share Kalyet Afya Foundation self-care tool for project participants. So far, these are the tools that we have been able to put in place in the communities in the health program. So the first thing, we'll talk about the self-care intervention, the mode of delivery, and the outcomes that we have achieved after implementing or availing these self-care tools in the community. And the first thing, we have the leaflets. And as I had said earlier, we offer self-care information in the community. And therefore, we have leaflets that are designed to have information on family planning, the various family planning options. And therefore, when our staff go to visit the community, they are able to give the women, they're able to give the youths these leaflets, and they are able to use them at home. They are able to read them comfortably at home. So that is one of the self-care tool that CAF has developed for the project participants. Another thing, we have the contact number. So we have an organizational number which we give to community members in case they need further information about something or they want to confirm something. So that number is open. They are free to call. They know about it, and therefore they are able to access any information regarding health through that number. So that is another tool for the community members. We also have digital interventions. And currently, when you talk about digital intervention, it has been working well with the young people because they're the ones who are able to access smartphones. So we have phone-based applications. For example, the girls, women of reproductive age, we encourage them to use some apps like My Flow app, My Tracker, to track their menstrual cycle. And so these are some of the very simple apps that community members, once they are told this is how we use them, it is easy for them. So that is one phone-based application. We have My Flow app tracker, or the menstrual hygiene, to track the menstrual hygiene. We also have an app that is called My Dawa app. Maybe most of you know about it. But when we talk about My Dawa app, it is for people who are able to afford purchasing some of these contraceptives for themselves. It can be a limitation if you are dealing with a very vulnerable community. And another, another self-care tool that we have contraceptives. And here we have two methods that community members can use on their own. They have control over them. So we give condoms and contraceptive pills. Those are the two that once we give simple instructions on how to use them, community members are able to use them. When it comes to other contraceptives, such as the injectables and the implants, those ones are done in our mobile clinics. So those ones are linked to the facility. So, but the self-care tool that they're able to use, they have control over them. So far, there are two. We have the contraceptive pills and the condoms. Another thing is the HIV test kits. And I'm talking about the oral quick, whereby you just use the saliva to test whether you're HIV positive or negative. And once it tests positive, you have to go back to the health facility for a confirmation. Another self-care tool that we have is the pregnancy test kits. We are able to give freely to women after simple explanations on how to use them. We also have quality drugs. As I had said earlier, we conduct mobile clinics. And when we go to these mobile clinics, they're integrated. We offer primary healthcare services, and therefore we are able to give quality drugs to these community members after prescription. Another, in the school programs, now those were the previous, what I've talked previously, those are tools that we have been using outside school. So for the in-school program, we have also some tools. And the first thing is the peer voice through peer educators. We have peer educators who are well-trained and they visit the schools to talk about sexual and reproductive health. So the peer educator is the tool that these learners can use to access information via. So we use them as a tool in the schools. So we also have SRH curriculum. We have developed our curriculum to guide the school program. And those are the ones that the peer educators use throughout the term or the year to educate the learners. We also have counseling and chat spaces. And these chat spaces is whereby when a learner is not willing to share his or her ideas publicly, we are able to have a private discussion with the learners. So that is another self-care tool for the learners. And we have also suggestion boxes in the schools, the SRH suggestion boxes, where learners place their questions or their concerns, and thereby we are able to address them when we get the papers read and discuss in the forums. And another thing, we have the menstrual hygiene products. And when you talk about the menstrual hygiene products, we have been teaching learners how to track their menstrual cycle using calendars, because most of them don't have the phones, and therefore we teach them how to do it using calendars, and it has been very effective. Another thing, we can support few learners who are very vulnerable with sanitary towels. And the other self-care tool that we use in the school is the interactive edutainment. And this is where we use games to deliver a certain information. So this is just to ensure the students are not very bored with the lectures. So we use games to deliver a certain information. So that is another self-care tool for these learners. And of course, the modes of delivery, I talked about community visits via our trained CHVs and educators. We have the mobile clinics, the villages, and the school visits. And some of the outcomes that we have been able to achieve, we have transformed norms, we have increased quality of services, we have increased individual as awareness of SRH as their human rights. We have access to SRH resources, information, and services in the community member. So this is a simple tool that Kalyet Afya Foundation has developed and has implemented already in the community. And we have seen these positive results. So next, Martha. So apart from what CAF has implemented, there are other self-care tools for health and SRH. And some of them include the self-administered injectables. Though they are limited, we have not incorporated in our project. So we have the self-administered injectables, whereby women can just inject themselves these family planning commodities, the injectables, comfortably at home. We also have menstrual hygiene products. We have the tampons, we have the menstrual cups. We have blood pressure self-monitoring, whereby a community member may have a BP machine and monitor the blood pressure at home. We have self-sampling for human papilloma virus, and this requires a test from the health facility. Remember, you are just providing the sample. After providing the sample, you go to the health facility. And we also have some hotlines that we can share. We have the GBV hotlines 119. We have the counseling hotlines 11090. And also we have other organizations that have hotlines whereby in case of any violence, you just call them and they respond. And I think these are some of the information.
Hi, Sarah, are you there? I think we lost you. Bernard, is everything okay with Sarah? Leah, are you still with us? I guess we lost Sarah, and before she's back, probably we can brainstorm on a few things. So the previous discussion was the self-care tool that Kalyet Afya uses for its project participants in the health project or program. And I'm just wondering whether the likes of COSDEP or Tubutu Africa initiatives, I know Inasol as well has something related to health, if I'm right. How have you documented such a tool, or you just do some of these things? You can please unmute and contribute as we wait for Sarah.
Okay. Hi.
Hello, Solomon.
Yes. In the self-care, in the implementation of these ones, for instance, when we are PNASOL partner with the World Vision, in some communities, like go to Nama. Nama is dominated by a religious sect of people who does not believe in contraceptives, right?
Yeah.
And there you see poverty is very high, because as young as 18 years and 17 years, they marry the children in the church, right?
Mm-hmm.
And they are found doing that. When you go and you want to introduce self-care by using contraceptives, there is a problem there.
Mm-hmm.
And we come out with a lot of education to let them know the need for the children to be protected, so that they'll be able to deal with poverty and give access to the children to go to school. So what we do is that we focus on educating the religious leaders and then the community leaders, like the chiefs, the assembly members, and the opinion leaders in the community. We first bring them to a particular center, and then we teach them why their children have to go to school, why they shouldn't give in to marriage at that age, so that they will be abreast with the information we have, so that we use them as an advocacy tool in the community, so that they will go to the community as chiefs and queen mothers and opinion leaders to be able to educate the community, so that this religious belief, they can penetrate into their beliefs and then give access to the opportunity to the children to have education. So self-care in these areas, like you see, I've been talking about the religious aspect more, because we Africans are more religious, and we focus most of the interventions, like we believe in the spirituality more. So if you're able to break the cycle of spirituality and then introduce a concept, it becomes very difficult for you to become successful. So this is what I can share. That what we do at Pinasol, we partner with religious organizations and other agencies to bring more education in the community, so that those who doesn't believe in contraceptives or accept and then protect the people against early pregnancies and then also early marriage. Thank you.
Wow, thank you, Solomon, for that contribution. I think I didn't think of it that way, but it's a very great contribution, how you infiltrate into communities that hold on to religious beliefs against contraceptives. So I think we have Sarah back. Sarah, are you there?
Yes.
Please proceed. Allow us to first finish, and then we can come back to the contribution. So apologies for that technical hiccup.
Yeah, sure. So the last thing I wanted to talk about here, we have any technique for managing stress, substance use, anxiety, and other mental health disorder. So either any technique that you may encourage community members or as an individual that you can use to manage stress, substance use, anxiety, and other mental health disorders, those are self-care tools. So, and they're not just limited to this. You can think about others. These are just a few that I was able to arrange for today's session. So next. So let's talk about the challenges facing self-care. And the first thing is availability. Yes, you can educate the community members about the importance of self-care, the tools that are available, but are they available in their disposal? Are they able to utilize them after having that general knowledge? Yes, they have the knowledge, but are they available to them? So that can be one of the challenges. You can educate them, but availability of the tools becomes a problem. And that can be a problem, especially in rural areas, where you can come with an intervention to educate the community members about self-care and the available self-care tools that have been developed, but it is not available to them. So you should check on the availability. Another thing is access. Are the self-care tools accessible to these people? And access, we can talk about the distance. When you talk about the health factor, we can talk about the distance to the facilities, the public facilities that are available, and also access in terms of cost. Are they able to afford? So accessibility can hinder the utilization of these self-care tools. And the other thing is acceptability. We can research about the culture in which you are working in. For example, when you talk about family planning, it can be very sensitive in other communities. In some communities, they view children as wealth. And therefore, when you go to them and tell them you should use family planning so that you should, to avoid getting too many children, of course, they'll just reject that information at when you just give them. But when you tell them that use family planning method to space the children, it will be more acceptable than telling them, no, the population is really growing high, you should reduce the number of children. Just try to help them to space the children, and later as you give that more information, they will understand why they should maybe reduce the number of children they are getting. And another thing, when you talk about the menstrual hygiene products, you may see tampons and the menstrual cups as being very convenient, especially the menstrual cups, because you can use them for several, maybe a year, the menstrual cups. But is it acceptable in the culture that you are working in? People have different views about these things. For example, tampons, people say that young people should not use tampons because it may break their virginity. So that's why I'm saying acceptability of the tool can be a challenge in case you don't give the quality information and tell them how to use them and the advantages that comes in when using these self-care tools. So be careful on the information that you first give in the community, because that will decide whether the people will accept the tools that you are giving them or will reject them. And I had talked about affordability, cost. And as I had said previously, self-care does not mean zero cost. And when you go to the community and don't emphasize that, it does not mean you won't incur some cost. It may cause some problem, because sanitary towels are self-care tools. And therefore, a woman will need to purchase that self-care tool if maybe there is no arrangements by an organization to provide them. So check the affordability of that self-care tool that you are giving to the community. If you are not providing for them, check the economic situation of the area and come up with a self-care tool that is within their reach. So next, Martha. Let's now talk about some of the benefits of self-care. We have better choice. It saves individuals time and effort. And this is whereby we are saying that it can save you time by allowing them to manage their health conditions conveniently and successfully by themselves. When you teach people about self-care, the techniques of managing mental health, they won't incur that cost of going to maybe for therapies, because they were able to maintain the stress when it was at a lower level. So you see, it is a better choice. You take the responsibility for yourself. When you feel I'm stressed, you have to just take a simple measure to reduce that stress. When you know finance is your problem, you just take a self-care plan to take care of your financial stability. And therefore, it is just a better choice. Another thing is a better care. Self-care empowers people to take care of their health and well-being in their own hands, giving them incentive to improve the quality of life. When you are able to take care of yourself, other benefits flows in. We talk about productivity. If you are healthy, your productivity simply increases. When you are taking balanced meal, of course, the chances of diseases just go down. So it is a better care. And another thing is better value. Self-care helps to combat rising healthcare costs around the world. And really, that is the rising situation right now. Even the World Health Organization is working on self-care. And together as local organizations, we are supporting that guideline by ensuring that people understand self-care, and therefore we reduce the cost of healthcare. And when you think about self-care from your perspective, organization's perspective, of course, we will be able to derive other benefits that will come in. For example, if your organization deals with mental self-care, of course, you will be able to protect yourself from mental health. You are able, in fact, economically, you will just be productive. All those other benefits will come in. Next, Martha. So we have a testimonial. So this was in one of our clinics, and every month, Kalyet Afya Foundation gives me a contraceptive pill. I'm not yet ready for another child. So we are able to do this because we have established static health. It's a static health clinic in villages. And thereby, communities know that every month at a certain date, the organization will be here. And thereby, we are able to give some of these self-care tools. So if you are choosing contraceptive pills, you have, a certain date every month, Kalyet will be here, they will give us. If you want condoms, we'll be there for you and provide. So this is one of the enabling environment or the places where we are able to put in or to use our self-care tools, to deliver our self-care tools. So next, Martha. So we have concluded the discussion, and what I would really love is all organizations to think about self-care, try to identify some of the self-care tools, document them, and thereby you'll be able to leverage on the benefits. Just think in areas that you are. You might not know that you are practicing some self-care interventions, but once you think about it, you'll know that we are helping communities to take self-care in their own hands. So we'll go to the question and answer session.
Thank you, Sarah, for the wonderful presentation. I guess we are all thinking about what exactly we need clarification on, especially for those of us who do not work in healthcare. And as we ponder onto the presentation, maybe we can go to Solomon's first question that he had, and he was asking, he stated, if I got it right, that in some communities, the community members are very vulnerable and they do not have the liberty to practice financial self-care. So what happens in such occasions? Solomon, if I captured your question right, say,
yeah.
All right.
My question was, when you were able to plan your budget, you want to know your income that is coming. And in the most communities, they don't know how much they will be going to earn. It's like they live by the day. So how do they practice this financial self-care, right?
Yep. Thank you, Solomon, for the clarification. And Bernard, Leah, Lillian, if you're there, you can also help Sarah respond to this question, or anyone else who has an answer, because I know the Good to Africa initiative also does work in this area. Let's hear from Francis Adai. Yes, Francis, I can see you've raised your hand. Sarah, could you please respond as we await Francis?
Okay, when we talk about these vulnerable communities, they may not know exactly.
Okay, I'm back here.
Okay.
Right.
I thank our sister for the nice presentation, but I want her to maybe emphasize something there, as Solu said earlier. If you can add these challenges, maybe the challenges were well stated, but if you can add the religious or cultural barriers, because when it comes to Africa, a lot of us are having culture or religious barriers in terms of concentratives. Some of the churches, let me be emphatic about Catholic Church, they do not accept concentratives, especially the condom. So that's also a challenge. So if Sarah can add to one of the challenges, I think it will be more whenever maybe do another presentation somewhere. I'm done.
Thank you, Francis, for the great addition. And Sarah, kindly please remember to add that. And please proceed to respond to Solomon's question. Thank you, Francis.
Thank you.
Okay, so as I was saying, about these vulnerable communities, whereby maybe they depend on casual work and therefore they are not sure exactly the amount that they get, their monthly earnings. But what we can help them as an organization, we can always do maybe an approximate. Maybe in a day, what is the chance of me earning this? And in a week, we can maybe start with a week. In a week, what do you earn? And maybe use an average on that. And therefore, we are able to approximate for a month, even if it is a little amount, this family gets a certain amount of money. And when we are able to do that, we can be able to make plans. You can budget. You see, when you talk about budgeting, it does not really mean having a lot of money. We can just try to budget that amount of money to balance the needs of the communities. So maybe we can think along that, helping the community, that individual family or person to be able to know this is the amount I earn, and therefore I can plan my budget like in this way, because this is at least what I get. So if I've tried to shed some light.
Thanks, Sarah. And I'm also now thinking along the line of Solomon. Those people who earn hand to mouth, like I'll get $1 and I consume it all because that's what is needed. Sometimes I don't get up to $1 a day, so I have even less to budget. I think what happens in such cases, not necessarily directed to Sarah, but anyone else who has encountered such a scenario can help us out.
I think, Martha, maybe this is where now economic empowerment programs come in. The organization has to think, because now that is a need in that area.
Yeah, let me share this. For instance, in 2018, PNAFO wanted to register children and for national health insurance. Those who doesn't have health insurance in some of the communities. And as part of the data entries, gathering data for the registration, there was a question that we asked them: how much do you spend in a day? And how much do you spend in a week and in the month? And after taking the data, I realized that some of them, they don't even know how much they even spend in a day, because they think that they go to farm and they get their cassava, their plantain, their yam, and they have those things and they come. They need only some small amount of money to buy some small fish. So that's all they did. So they don't even know their income. But going through that exercise, we're able to let them know that, okay, this is how much at the end of the day. If you don't have anything, you have this in a week. So when you are planning your life for the week, you should know that this is what you have and how much you can even put to support your children to school. So it's like what she said. We only have to let them know that they don't have to get all much before they can plan their life. The little one that they have, they should be able to know, okay, so if you are spending, let's say, 1 Ghana cedis in a day, then we have to make sure that when we have 1 or 2 cedis, we don't spend over more than 1 cedi in the day, so that you can have a reserve of 1 cedi for the next day. So if we do that, we'll be able to help the people to plan. Then to also contribute, for instance, before the COVID, we were running a campaign program for a pad, right, for sanitary pad for girls. And when we have it for them, it was free that we give to them, so they were able to control their sanitary issues. But recently, there's a debate in our Ghana Parliament whether to scrap taxes on sanitary pad. You will see, these girls are not able to afford this sanitary pad. So you see that their health issues, related issues are compiling. And I'm thinking like we as civil society organizations and NGOs, whilst we have to make effort to influence government policy on some of these ones, when the parliament and other lawmakers are meeting to discuss issues about girls in their schools, we have to add our voice so that when they're making policies, it will help these young girls to have the freedom to live. Because now, if you have a daughter or you have 2 of them, and look at the economic circumstances, it's very difficult for you to provide these things to them for every month. And that's why some of the girls are going astray. Some of them are not going to school, and some of them even fall up into the trap of men for money and those things. So let's just add our voice to this call so that policies may be changed for our young girls to have better chance when they're looking at their self-care. And then if you have the opportunity and you are writing like proposals and doing fundraisings, you should also put in some of these things for these girls, like contraceptives and other things, so that this will not affect their health in the future. Thank you.
Thank you, Solomon, for shedding light to that question. Yes. Hi.
Yeah, this is Hilary. My hand has been up for a while.
Oh, sorry, I didn't see it. Yeah.
Yeah, just to say that I want to commend Sarah for the presentation, and also to was worth mentioning the issue of self-care, even for you, the worker. I think that that is one thing that usually eludes us. We spend all our time and our energy on others. We forget that we also need care. And so I think she talked about issues of meditation and stuff like that. And I think that we here, this probably is a direct message to us. We have heard what we can do for others, but what can we do for ourselves? And I think that that's one key point I have taken from her as a key reminder that also look within yourself. How do you ensure that you take care of yourself? So thank you once again for that.
Thank you, Hilary. Any more questions? Yeah, remember to take care of yourself. Go for swimming once in a while. Go for a walk. Go to the gym or for nature walk. Ladies, we call them face. Is it face routine or what? Yes, take care of your skin, they say. And men as well. I think men forget a lot. If no further questions, allow me to say bye to those on Facebook Live, and we can do an in-house sharing. Yeah, I think at this juncture, we share notes, like how exactly are you doing it in your own organizations in terms of self-care for project participants. We've had several inputs from Solomon. Sai mentioned a few. Jane, can we please hear some more from other organizations?
Hello.
Hi, Maureen.
Hi. So first, I would just like to say thanks to Sarah for the informative presentation. And then just to give an example of how All Cup brings in the self-care, we normally organize sports days, so sports events. We used to do it yearly, but right now we try to do it like quarterly. So we normally invite the community members together in the village. You know, people don't know about gyms or like how to exercise. So we normally bring the community together and organize several activities like athletics, football, volleyball, tug of war. Sometimes that's very funny. Sometimes you put women on one side and men on one side, and you know men will win. But you just want to do it for the fun. But then sometimes you mix the men and the women together. And then we have another activities like the egg on spoon race, sack, like people hopping in sacks. So normally we bring the community together to exercise. And then after the activities, we will have mentors who come, maybe from the local government, someone from the health department to talk to the community about health issues in the community. If malaria is prevalent, then they talk about how to prevent using nets at night, ensuring that there's no stagnant water and such. What the others have talked about, HIV testing, we encourage the youth to come and test, talk to them about how to prevent infection. Yeah, so that has really helped. We normally try to do that with the staff. So we have weekly meetings where staff meet together and just unload. Like if someone has a concern, they feel like they need to talk. So we have seen that helps a lot. instead of someone maybe just having up an issue or problem and sitting with it for months before they try to talk to someone, we try and have weekly meetings where we're like, okay, this is, if you want to talk about anything, personal, work-related, people are able to share. And a few people who've been through the same problem or are going through the same problem normally help. Yeah, that's from Allcap.
Thank you, Maureen. I think Allcap based their sports on adulting is a scam. So they relive their childhood days by these games, which is a good thing. Anyone else?
Yeah.
Thanks, Maureen.
Especially when you see the women, the women who are middle-aged women, and they try to run and they take 3 steps and they fall down, but it's good fun.
I can imagine. That is interesting. I also had Pascalia say that they have Pascalia, if you're there, you mentioned that you do financial self-care, and you mentioned that you have a financial stroke social curriculum. So anyone who is interested in developing a self-care tool along that line or interested with the curriculum can get in touch with Ubuntu Africa initiatives in Tanzania through Pascalia. Then we have Sarah with their self-care tool, and they also have a curriculum, if I heard her right. So get in touch with Sarah to get the health curriculum she talked about. Did I get you right, Sarah?
Yes,
you have
Sarah.
Sorry?
As for the school program.
Yes, for this. It's the mentorship curriculum, is it?
Yes, yeah.
Perfect. So you can also get in touch with Sarah for that curriculum. Anyone else wants to share in the next 3 minutes before our time is gone?
We only want to thank Sister for that good presentation. I think it's well presented, and we hope to incorporate them into our organizations to make sure we are safe and sound. Thank you.
Thank you, Solomon. We are going to put it on YouTube as well. The presentation on YouTube, on the website, it shall be on Facebook as well. And if need be, you want a copy of these, like Francis requested, we are also going to share with you. And I also see someone's hand, Francis. Jane, are you saying something?
Yeah, I just wanted to appreciate.
Sorry, we can't hear you, Jane. Anyone else with a comment? Anything to share before Jane comes back? We lost her. But I guess Jane wanted to appreciate your presentation, Sarah, so thank you. Francis' hand is still up. Not sure he wants to say something, but I also see Etali in the house. Etali, are you there?
Yes, Martha, I'm there. Thank you for saying hi.
I'm not sure at what point you joined. Do you have any comments today?
Well, I don't really, I came in when Sarah had gone so far off, and I got a little bit of what she was saying towards the end of it. And all I can say is that it's a good practice, given that we are all supposed to be doing a holistic kind of intervention. I think there are some practices which are pertaining to our colleagues from other organizations, which are important for us to see how we can begin to incorporate so that it makes us complete in our processes of interventions. The issue of self-care is an issue which is very important. And I also, I think it was it Solomon? No, it's not Solomon. It's, what was that again? We talked about the fact that we're also looking about ourselves in self-care. I think it was
Hillary.
Hillary, yes. I think it's something which is important for us to see how we begin to see, because, it's like we get to put in much and we don't see how we can also re-energize or maybe detoxify ourselves in the issues we are doing. And sometimes we do not also see the need that we need to also have this kind of attention towards ourselves and our staffs. So it is important that we begin to see how we can begin to put them. And I also want to appreciate the fact that you are saying that it is possible that from Tanzania, who is our colleague from Tanzania, they are talking about seeing how they can help us in trying to do this. And that is the essence for this expert talks. There are areas of interventions which we all are not intervening in. There are things or practices which may be specific to our communities, but it is important for us to ensure that we replicate these practices. I think for us to be successful in delivering our interventions, we need to be able to replicate some of these practices. So I want to really, really laud the effort of Sarah, and also to say that, sometimes when you are intervening, those are I used to call those kind of, we used to look at those interventions in the area of self-care, like she was trying to address, like in the issues of HIV and all, and also you see the use of contraceptions, like one of our other colleagues said. This is something which our context or our culture is not really accepting it because of the kind of way we grew up in. The cultural realities did not really embrace this so well, and it takes a lot of effort to see how they can put that through. And also, one of the things that we also have to understand is that back in our communities, we are talking about communities where people are struggling to see how they can be able to even get staple meals per day, like Solomon was trying to analyze. Having staple meals a day is not an easy thing, and all they know is about how to secure the next meal, maybe the next day, and all of that. And they might not be seeing how it is necessary to save some money to be able to see how they can also take care of that, because the health is part of the process. If you don't have health, you will not have they will not be able to live a comfortable and a life that is totally free from these issues. Because maybe we look at poverty, the way we look at poverty, maybe we look at it in form of just getting access to finances, but we don't know that it is also important to see that health is an issue which we need to also take so seriously. So I really want to laud the effort of CAF, and I see that they have done so much work in that area, which is something which we all need to be able to emulate, and also to see how best practices we can use in order to come around with the traditional beliefs, traditional concepts, and religious kind of beliefs or policies, which are always standing in the face of this intervention. So I think that if we could start thinking of better ways of innovating in our practices, not focusing on telling the children, and maybe focusing on educating the caregivers or the providers on how best they can do it, it is possible that in collaboration with them, it is possible that the children or the girls are able to accept and to see them as concepts which can help them to live healthy lives. So I just want to say that's just what I could make as a comment, and I think that it is. I'm so glad and blessed that I was listening to it. Thank you.
Well, thank you. Etali from Sustain Cameroon, and for that great conclusion. And I believe each one of us has learned something which you can implement for yourself or for your organizations. And for those in advocacy, try to influence policies in your space as a CSO as much as you can, so that we are able to change the lives of the people we work with. So many thanks. I hope I didn't stop anyone from saying something before I end the meeting. We are already 5 minutes post the planned time. All right. Thank you, everyone, for joining. Thank you, Sarah. Thank you for your contributions. Until next time. Bye. Bye-bye.
Bye.
Bye, Maureen.
Bye. Bye.
Bye, Francis. Bye.
Thank you.
Bye, Tali.